That's okay. Hi, good evening, everybody.
Good evening, sir.
Good evening,
Hi,
sir.
good evening. Can you hear me?
Yes, sir.
Yes, sir.
Okay. We have a smallish audience today, which is all right. I think you guys had a lot of talks today. I think this is the fourth talk of the day, isn't it?
Yes, sir.
That must be a very long day, I'm sure. Okay, so let's start sharing screen. Start my presentation. Okay. Share screen. Okay, can you see my screen?
Yes, sir.
All right, fine, that's good. Is it 5 o'clock? Yeah, it's 1 minute past 5. Just wait a minute. Okay, Duki. So a lot of us are, homebound. We are going through a difficult time, and a lot of us have been so busy with our lives that we've never had time to catch up with technology or what is available in the market. So today is all about trying to give you an insight into how to change your lives using technology. Okay, some of you may have heard some part of the conversation, but I'm going to go through a few things from a medical point of view, and then, as I promised you at the end, we'll talk a little bit about financial management and how to look at getting your finances right and things like that. Okay, so everybody knows this. We've all heard Bill Gates. We've read this in one place or the other. Life is changing fast for all of us, and coronavirus has brought it to the fore. It has very clearly shown us that things are changing very fast, and so the only thing constant in life is change, and that's the most important thing. And change is an opportunity, is like an opportunity. It's just one word away from chance. So if you change chance, it becomes change. And so don't be afraid of change. A lot of people are afraid of change, and I will try and address that. My whole idea of the talk today is to address the resistance to change. Okay, I'm going to mute everybody so that we don't have any noise, and then we'll continue. Okay, so change is actually, it's a, for me, the way I look at change is it's always an opportunity to reflect on life and to make to live life in a different way. Okay, that's the real thing. So if you think you can, you're right. Okay, a lot of people are there in the audience who think they can change, and they're right. But again, there are a lot of people in the audience who think they cannot change. That's their attitude in life. And the reality is, if you tell yourself that you cannot change, then the chances are you will not change, and you're also right. So there is no such a thing as right or wrong. It's your own conversation that you have with yourself that decides whether change is positive for your life or change is a negative factor for your life. So there is no right or wrong. But in cardiothoracic surgery and in life, very often we ask ourselves the question, why should I change? If everything is working well, what is wrong with being in status quo? And nothing wrong with being in status quo. This phone can still make a call to New York, Paris, London, New York, Tokyo, everywhere. But honestly, if you look into your own lives and practices, if you put a hand into your own pocket, you will see almost everybody's got the latest iPhone, it's got the latest gizmos. And the reason why you adopt technology is because technology makes your life easier. And not only your own life easy, technology also makes the life of your patient better. Technology helps you to get good clinical outcomes. Technology helps to reduce hospital stay. Technology helps to reduce pain. Technology allows the patient to go home faster and to return to work faster. So adapting change in our clinical practice actually impacts not just your own life, but it also impacts the patient's life. It also impacts the financial status of your hospital. It also impacts the society because your family can have you back earlier. And more importantly, because you're back to work early, it impacts the healthcare of the whole country. So everything that I say from now onwards is with that background in mind, that we are here to actually impact the healthcare of the country. And that is why we talk about changes that are going to happen in the near future. The best example I can give is a daily journey of a surgeon, and this is my journey before 2 weeks ago. Okay, so obviously the coronavirus has changed things in a big way, and I am also continuously adapting to the change. But I'll take you through my daily journey. A lot of the technology which I show you is actually available in the market, not just on in the labs and all. These are actually now available in the market. I have access to some. I have tried others, and some of them are updates from the various labs around the world. So this is to give you an insight into what is coming, how we're going to change things and stuff like that. Okay. So as a cardiothoracic surgeon, as a thoracic surgeon, my life starts early morning. 4:30 a.m. is usually my start time, and my day starts with a gentle music reminder. My iPhone goes off, and there is a bedside table lamp which will play its music and very, very gently soothe me out of my deep sleep, and I'll get up to start my day. As soon as I get up, I will actually click on my iPhone, and there is a connection downstairs. My bedroom's on the first floor, so there's a connection downstairs, and the eye kettle gets started because the water is already has been filled in the night before. So as soon as I get up, the kettle is on from the bedroom. I just click the button and the kettle starts and the tea starts to percolate. Okay. And just as I'm getting up and rousing, I'm going to go through my phone, track all my sleep records. I'll see whether I've rested well. Did I have a good night's sleep? Did I have a bad night's sleep? I will catch up on my health and fitness from yesterday, so that I can set my goals for the day. So my watch automatically coordinates with my iPhone, and it gives me a tracking of how many calories I have spent last night, what was my health status yesterday. So that will help me to motivate me to set targets for today. So these are sort of basic things. And then you walk into your bathroom, and then you've got your eye toothbrush, which actually talks to your phone, and it keeps a track record of your dental health. It tells you with the color changes from red to green that you have actually brushed your teeth for 2 minutes. And this is important because none of us realize what is exactly 2 minutes. So most of us are in a rush. We've got things to do, so we just rush through the day. But actually, this is a new technology which tells you exactly if it is still red in your hand, then you haven't spent the right amount of time. And then if it turns green, then you know that this is good for your oral health. Having done that, you can check your prosthetic health by looking at the P stream. It is all inbuilt within the technology, and as you stand for doing what you have to do, you know that your prostate health is healthy. Your stream is good. The flow is good. And you've also got ways of measuring fecal occult blood. You've got ways of measuring fecal calprotectin. So instead of taking a sample and sending it to the lab, your throne is actually giving you an insight into your health, because it actually accurately measures what is the composition of your excreta, and it actually very, very early it gives you warning signs if things are not going correct, or if there is evidence of any occult blood within your stools. So this is all inbuilt within the toilet seat, and you don't even have to take a sample and send it off to the lab. Having done your basic bits that you need to do, you come out, and then you want to exercise early in the morning. It's the best sort of time to do your exercises. I have a personal trainer on my phone who sets my targets, and I have things designed for the whole week, so you can actually go back into your app and you can do your exercises at whatever level you are. You can do basic levels, you can do advanced levels. If today you don't feel like doing yoga, you can do cardio, you can do other stuff. So it's all personalized, and it's all set for you as a surgeon. And just as you're about to finish your exercise and get ready for the next step of life, you send a beam to your eye shower, and the iShower picks up the signal from your app, and it sets the temperature right. It sets the exact temperature of what your body needs. So it is able to sense what is your body's temperature. It's able to sense what is the surrounding temperature in your house, what is the temperature outside. And then all these things are manipulated, and the correct degree of temperature is set onto the shower as you walk in. Having done that, it's 5 o'clock. So first half an hour of your life has been, of your day has been pretty productive. And now you are ready with a cup of tea in your hand, and you're sitting on your desk to start your international practice. And this is from my life. So I'm sharing all of this because this is what I do on a day-to-day basis. So the moment I start my international teleconferencing, I will actually probably have a link up with my secretary. I have a couple of secretaries, one in London, one in India, and I also have a digital secretary. So I link up with all of them and try to first set the pattern of the day, try to catch up on how many consultations are lined up for today, what are the operations lined up for today, what are my patients in the other countries doing, and things like that. And so this digital secretarial services actually through the day, it takes your telephones, it takes your emails, it checks everything, it's books in the appointments. If you've done any digital transcription, you've dictated any letters, then it will actually automatically transcribe it into a readable format. And so your whole day is managed by the digital secretarial services, which is all online directly through your phone. So you don't really have to even talk to anybody. It all links up automatically. Your practice marketing, if you're in private practice, you need to make sure your things are being marketed. Your branding is repeatedly put out there. If you've got bills which have been sent out, your digital secretarial services actually chases these bills and makes sure that there is no outstanding payments. Invoicing is done for the patients either for the next day or the previous day. So all of it happens digitally, even before you have started trying to talk to somebody. Now, having done that, I will then take my dictaphone, which is a digital dictaphone. On my phone, there is an app. It's a speech recognition app. Any special instructions which I want to place, I will place on my phone, and these instructions go to all my various secretaries. If there are any letters and things that I have to do, any papers which I have to type, I will dictate it into the software. The software automatically recognizes all of the audio. And of course, because you're using the software over a period of time, the recognition capability becomes pretty good, because these softwares in fact improve with the usage. So the more you do, the more it is able to understand your accent, your words, your pauses. And so more accurate is the transcription of the letters. So initially, when we first started using these many years ago, they were not so accurate, but over a period of time, they've become much more accurate. And now the papers and letters are grammatically checked and factually checked, and they're quite accurate. So when they come to me on my desktop, I just have to glance through it. I don't even have to make that many changes now. Of course, in the first year or so, we had to make quite a few changes, but now they're all beautifully laid out exactly the way you want. And then I have a software called as DocuSign. And DocuSign automatically signs off all of the letters that are on my desktop. Once I click sign, I've read it and I click sign, it signs off the letters. And it has also got the ability to actually send the letters out to the various patients, to the GPs, the other stakeholders for the patient. So, the other consultant who has referred a patient will get an automatic letter from my laptop, signed by me digitally. And also DocuSign has the ability to read contracts. I deal and work with a lot of different hospitals. I deal and work with a lot of different companies. I have a lot of other activities going on. So DocuSign automatically picks everything up. Along with this digital services, there is one additional service called as medico-legal service. So in the medical legal service, the DocuSign will actually pick up my document. My digital secretarial service will pick up my contract with whoever I'm signing it and send it off to my solicitor. And then my solicitor will read it. He will also digitally go through it, make any changes, and then it comes back to me. Sometimes I work with companies when we are trying to discover new technology, when we are trying to discover new products for the market. And most of these companies will actually want you to sign what is called as a non-disclosure agreement, because obviously these are highly confidential technologies. So they will actually help me understand the need of the non-disclosure and everything. And the whole document comes back to me, and I sign it, and it just gets signed off. You know what? I forgot to record. So let's start the record. Okay. Having said that, once we've signed off all our letters, then the next step is to check the social networking side of things. Usually my digital secretary would have worked on that. Nowadays, almost all practice goes on to social network, and you've got to keep up to date with what are the requests of the patients that are coming across to you. Sometimes some news articles are written and things like that. So you spend a few minutes trying to update yourself on what is the social networking side. Is everything accurately represented or not? And then you start the rest of your day. So you've spent at least 10, 15, 20 minutes going through all of this with your secretary. You've tidied up your day, and it's about 5:30 in the morning. And 5:30 in the morning is when my first consultation starts. I have teleconferences booked for 5:30 a.m. in London time. The teleconferences could be with individual patients who are in various countries. They could be, anywhere really. Australia, Africa, the Middle East, and then I have appointments booked with international hospitals. So I have a link up with many hospitals. The technologies that we use are various depending upon the availability in the other hospitals. So, we can use Zoom, Cisco WebEx, Microsoft Meetings, Google Rooms, whatever you want. There is a lot of technology available depending upon whatever is the level of safety, security, and the needs of that country. You cannot decide one technology and stick to it. You have to actually use a mix of technologies, and you try and fit it to what is the need of the country. And so different countries, I use different link ups. Of course, because data of the patient is coming across borders, you have to make sure that whatever teleconferencing modality that you use, it has to go through the security of the hospital. So all of that security has to be very high level. You've got to make sure that all the data that reaches you is confidential, and all of us within my whole practice group are actually registered with the ICO. It's called as Information Commissioner's Office. Information Commissioner's Office is a registration where once you register with them, you are actually agreeing to data confidentiality clauses. In last year in June, Europe came up with a new concept called as GDPR, and GDPR is the new standard for data confidentiality. And so nobody can collect your data without your consent. And because we are all registered with the Information Commissioner's Office, we have actually signed up to the GDPR. So anything that I do on my computer, on my laptop, is all highly secure, and most all of it complies with the GDPR requirement. So most of the time we are fairly happy that whatever confidential data that is being passed across to my laptop or to my phones are all under serious security covers. Then starts the video consulting with the patient. Usually it is multi-level consulting, which means I am on one platform, and my patient will be on the other side. But at the same time, his family could be anywhere in the world. So I have consulted with patients who are in the Middle East, the son is in Australia, the daughter was in America, and all of them log in together, and we have a large sort of a web consult with not only the patient but also the family. This actually helps to develop a relationship and a rapport with everybody, and more importantly, it helps you to answer all the questions that people are asking or any doubts they have in their mind about the treatment or the other options that are available to the patient. So it is almost like a multidisciplinary meeting with the family rather than the other physicians. But I also have the option that if they want to discuss with an oncologist, then and on the same call, I can actually log in an oncologist. For example, I had a patient from Australia who presented with melanoma, had treatment, oncological treatment in Australia, was taking immunotherapy in another country. Her husband was a diplomat, and so he was posted in another country. So the immunotherapist was in another country. I was based in England. So when I spoke to this patient's family, she was in Australia, her children were in England, I was in England, her basic oncologist was in Australia, and an immunotherapist was in a third country. And we were all talking at the same time, deciding what is the treatment, best treatment options for this patient. So many, many times nowadays, because of this digital technology, we are able to talk freely with any physician and any surgeon together. And the beauty of it is that we are actually linked online with the radiology department. So my radiologist can be in a fourth country. He doesn't really have to be in the same place as I am. And he will share all the data with me, and he will discuss the radiology in detail, showing me the images. I will ask him the required question. He will give me the necessary answer. So it's like a online multidisciplinary meeting, but a truly international experience. So having done that, then the patient, wherever he is, we usually have outreach clinics in various centers. And if the patient is able to log into the outreach clinic, that is fantastic. Otherwise, we try to make sure that they have access to some of the devices which I'm going to show. So if they get into the outreach clinic, then the patient's blood pressure gets taken and gets logged on onto my computer. His vitals are recorded, temperature, pulse, respiration, and directly from his own phone or the phone of the outreach clinic, everything is uploaded to me sitting in another country, and I can get a whole analysis of the basic workout for this patient, including his weight, his body fat analysis, etc. What's his diabetic status, what is his blood glucose status, and there is availability of eye stethoscopes, and these actually are fantastic devices. So you don't really physically have to be next to the patient. You log on your iPhone or the patient's iPhone onto the stethoscope, and whoever is the nurse at the other end will auscultate the chest for me, and I will get all the signals on the other side, either via the internet or Bluetooth enabled, and all the interpretation can be done by me as if I am almost physically present with the patient. There are other devices which this is used by the orthopedic surgeons who do bone density scanners, and particularly in the chest when we have got metastasis to the ribs. This is a good device which will actually highlight to you areas with defective lesions on the ribs. There are endoscopes attached. This is a camera actually, and it's in the form of an otoscope, or you can have a oral camera attached, so the patient can put it in his mouth and you can have a look, and everything comes to you onto your desktop, and you can make a direct analysis of at least the basic vital parameters of the patient. This is the new technology which has come in called as home blood test kit. Patient does a pinprick, and this cartridge which you see here, he just puts it onto the cartridge then goes into the machine, and the machine automatically analyzes all of the blood results. Renal function test, liver function test, you can mix and match with whatever you want, and then that result in a live scenario can get actually transmitted to me. Some tests take much longer, but at least the basic test can be transmitted live to me on my phone or on my screen, and I can actually see whether this patient's got anemia and things like that. Specific situations when people talk about allergies and things, this is a superb technology called as NEMA, where you can, if the patient's got allergy to certain things, this can be handed out to the patient wherever he is about to eat his dinner. He can put the little bit food into this device, and immediately it will sense whether there are any allergens for the patient or not. And if I want to use it to test my patient, I will get a live report of any allergens, and I can advise the patient accordingly. On my systems, I've got almost every electronic reference tool and calculator that you can imagine. So if I need to assess the risk score, if I need to assess any cardiac comorbidities, if I need to assess any thoracic comorbidities, if I want to have thoracoscore, I want any other information of the patient, I have the calculators on my smartphone, and I can actually very easily, it takes me less than 2 seconds to find out what is the predicted post-operative FEV1. All you have to do is punch in the numbers, and the number comes out on the other side. So these are very, very good tools. Not only are our devices available for ensuring that you do pre-operative, there are also devices available for ensuring that you have medication adherence, particularly when we talk about tuberculosis or when we talk about elderly patients. When we are prescribing some medication to an elderly patient, very often the patient may actually forget whether he's taken the medication or not taken the medication. Same thing with tuberculosis, the patient may not take the medication. That's why you have the DOT program to ensure that the patient takes the medication. So these are devices on the bottles of the medication. The cap is specially designed. Every time the cap is open, there is a link to the Bluetooth, and a box gets ticked that the patient has opened the cap. And then when he takes out a tablet and he closes the cap actually measures the weight of the remaining tablets. So the moment you know what is the weight of the remaining tablet, you can actually calculate how many tablets did the patient take out and how many tablets did he take. Of course, it depends on, the patient can throw it into the sink. That you cannot monitor. But at least it tells you that the patient has put in the attempt to take the tablet out and do that. So this sort of information comes to us pretty quickly, and it is quite helpful for us to analyze things sitting in a remote location. ECG probes are now available on the iPhones. You just need to plug it in and put these leads, and the ECG gets taken up. Particularly when a patient is getting acute MI, you just plug this in, plug it into the iPhone. The iPhone, through the World Wide Web, will quickly contact the nearest cardiologist, who can actually give you live support and can give you live instructions on what to do next. The similar things are in the thoracic world. You can actually, the patient can blow into this device, and purely by blowing into this device, which is attached to his smartphone, we can get a whole lot of spirometry and various readings. So these are not just good for preoperative diagnosis, but also for knowing how well the patient is responding to treatment. And also when the patient gets discharged, you can actually keep a follow-up on the patient to know that there is no early drop in FEV1 and things like that. So these are sensitive technologies that are helping us to detect complications early, and they are also helping us to follow up patients to make sure that they are following adequate treatment protocols. And all of this is cloud-based. So the patient is here, and the moment he coughs or whatever, it all gets uploaded into the cloud, and the physician gets involved, and the physician can actually then feed back to the patient or feedback to the device that the patient is reading, whether the dosage is accurate or not accurate. Sometimes in a couple of hospitals, they have guided ultrasound. So this is a very nice technology which links on to your iPhone. And sometimes a patient is in the A&E with an acute injury or something like that. And I have asked them to link the ultrasound to the phone or to their computer, and they do a rapid scan. And as they are doing the scan, the image is being relayed back to me. And I can actually guide, despite not being in the country, the accident could have happened somewhere in the Middle East, and I could be sitting in London, and they will send me these ultrasound scans very, very quickly to tell me whether there is hemothorax or things like that. And then I can guide the local physician on whatever is the next step of management, or I can tell them do a CT scan and things like that. There is also availability of these daily health monitoring apps, which are fantastic. Particularly, eye health is a very, very big thing in the Apple environment, and Apple Watch and Apple phones are really the next big health frontier that we will all face. And if we don't adapt this technology early, I think we'll be left behind. So it's very, very important to keep abreast of all the technologies that are available to you and that are coming out to you live. Having said that, once you've done a few of your teleconsultations in the morning, it's time to do the ward rounds. I may have operated on a patient in one country, and I may have left the country to go to the next, and so I have access to a ward round. My team will actually take the iPads. The electronic medical record of the hospital is stored on my phone as an app, so I can log into the app. I can log into anything about the patient, no matter which country I am. So I can see the daily graph of the patients. I can see the blood results. I can see the CT scans. I can see today's X-ray. Everything can be accessed from one single point of access, and it all comes onto your iPhone or it comes onto your desktop screen. And so it's very easy to do a ward round with your team. Your team carries the iPad around and updates you on each and every patient that you have done. And that is the way we conduct an international clinical practice. As I told you, many a times I get called into the ER situation. I may not be in the country. This is maybe a remote hospital where they don't have a thoracic surgeon and they've got a chest trauma. They will actually phone me and say, so-and-so is coming in with so-and-so trauma, and I will actually get onto what is called as a COW, computer on wheels. The computer on wheels is a VR system which actually allows me to look at the patient, look at the staff, and gives me an input into what is happening. And I can guide the local physician or the surgeon or the nursing staff to what is the next step in the management of the patient. And the time is still 7 o'clock, and we've already finished 5 countries teleconferencing. We have finished ward rounds in various continents across the globe, and we have already done most of our paperwork with our international secretary. So even before you wake up, I have actually already finished almost a huge chunk of my responsibilities. And then it is time to go to work. Now, this was a few weeks ago when I was actually traveling to work. So I would book my ticket using the app. I usually take a train to go into central London. I live near Heathrow. I don't usually drive into London because it's almost impossible. And then you read your newspaper on the phone, you check your stock prices. It is important to make sure that you're financially secure. Things are going well for you. Any banking requirements, as I'm sitting in the train, it takes me an hour to get into central London. You do your online banking, do all the stuff that you need to do, and then get into the hospital, do your physical ward round as we would normally do. And then once you've done your physical ward round, it's time for theater. And most of us usually operate on a daily basis. Once you're in theater, then the whole scenario changes. The question is, does the phone have any role in the theater? Now, I've shown this before to people, and I've said that whenever you think of thoracic surgery, you think of all these big incisions. But I was very fortunate to get involved with the VATS program very, very early in my training days, along with Khalid Amer. And we really pushed the boundaries of VATS, and that VATS was the predominant reason why I moved from cardiothoracic to mainly thoracic practice, because we were doing such good VATS and so much amount that it really became beautiful. And then various authors around the world have pushed the boundaries of VATS. So Joel Dunning has spoken about microlobectomy, where he has reduced the size of the incision to 5 mm ports. These were 10 mm ports. Alan Seho in Hong Kong spoke about needlescopic thoracic surgery, where he reduced the size from 5 to 3 and then 2 then the people in the US spoke about 2 ports watts. And then Diego Gonzalez Rivas, Calvin Nug, and Alan CO really pushed the envelope into uniportal watts. And over a period of time, they have shown us that anything and everything is possible on the uniportal platform. But pain continues to be an issue with thoracic surgery when you go through the chest wall. So other people are looking at other accesses for the chest wall. Marcin Zielinski talks very highly about transcervical lobectomies. He is a guy who does a lot of VAMLA and TEMLA, which is mediastinal lymph node dissections. And he is very comfortable to access the whole of the pleura, right or left, through the cervical route. So he does a transcervical lobectomy. The problem with that is you're left with a visible scar. So the Taiwanese guy, CC Liu, and then now the Chinese guys from Guangzhou have said that instead of going transcervically, why don't we go subxiphoid? And so the bandwagon has moved into subxiphoid lobectomy. And I know at least of 2 or 3 people who are working on transumbilical lobectomy, where through the umbilicus, they dilate the umbilical vein and pass in a camera probe across the diaphragm into the chest. And this has been done on a pig. And it is showing that it may be a natural orifice technique to do a transumbilical lobectomy. I told you this yesterday or day before, the Jianzhen He has really revolutionized the whole concept of surgery by making it into awake thoracic surgery. And not only awake thoracic surgery, but he's gone down the road of tubeless VATS, where he doesn't use any central line, no endotracheal tube, no urinary catheter, no arterial lines. And he has written a textbook on it and proven that really these are things that are possible. So technology is moving along. And then, of course, we come into the other era of robotics, and that's another world altogether. And I'll talk about it. So the question is, do smartphones belong in the OR? And let's look at what is possible with your smartphone in the operating theater. How can you change your concepts? So we are all traditionally used to this big trolley, the HD screen, and we've got all these insufflators, light source, xenon light source, LED light source, everything is available. But now it has all moved on. You do not need this big trolley at all. What you need is this small camera device, which actually plugs onto the end of your endoscope. So this device is all that you need. All of this has been now condensed into this. And you just need your laparoscope to plug into this wireless device. And this is your light source. And this wireless device has the ability to beam the picture, intrathoracic picture, to anything. So you can have an iPad, you can have a phone, or you in your own theater, you can have a 72 screen. The new technologies that are available, the newer television screens, are all 4K compatible, and 4K compatible is 20 to 100 byte, whatever number. And so these are very high definition screens, and you don't need to physically connect any wires from A to B. And the other important thing is that this wireless thoracoscope can actually be carried in a small briefcase. So you don't need to buy a separate scope for various hospitals. You just finished in one hospital, do whatever you have to do, get it cleaned, plug it into, put it into a briefcase, and move on to your next case. So things have changed quite dramatically. Monitors are no longer really in. I think in the next 5 years or so, we will see almost all monitors dying off. We are now entering into the image display technology, which Google first showed in its patented technology of Google Glasses. So the image now is actually being projected either onto the screen in front of your eyes, your thing, or it's being projected across a small horizontal device. The beauty of this is, if you know a little bit about optics, you will understand that when you reduce the distance between the screen and your eyes, and you change the way it is projected, you can get a 72-inch three-dimensional view in front of your eyes straight away. So this has the potential to blow up the picture to a very high size, and you can also get a very high definition picture. So both of these, if you wear, you don't really need any television screens. The good thing about using something like this is it's very, very good for your neck and your shoulders, because when you're operating in theater and you're trying to do surgery looking at a television monitor, the problem is that your neck and shoulders start to hurt. And very many times we've had thoracic surgeons, we've had cardiac surgeons who actually have to leave their careers and leave their jobs because of back pain. So this new technology will actually help you to overcome those issues, and you can keep your neck and your shoulders in a position where you are absolutely comfortable. Technology has also gone down the 3D route. So we know there are thoracoscopes available which have 3D technology in them, and you wear these glasses on your face and you look at the screen and you get quite a decent 3D image with this. But smartphones have now gone 3D, and this was a technology which I tried out in Taiwan, and it was just unimaginable, and really I couldn't believe the depth of perception that you got with this sort of device on your head. And this is all connected to your smartphone. And not only that, along with this technology that I've got on my head, you can add a fourth dimension of a virtual reality. So the virtual reality plus this thing on your head gives you an amazing view of what you're looking at. And so when you're operating, you don't need to move your head too much. Everything is in front of you. It's three-dimensional, and the depth of perception is just as good as robotics. So that is why these technologies are really going to change the way we are going to talk about surgery. And these are not in the future. These are already here. I visited Professor Sangun Jeon in South Korea, a national university, and he has got a theater called a Smart OR. And in the Smart OR, all these technologies are available. There are at least 10, 15, 20 screens at any particular time. And on a flick of a button, they can relay any operation to any part of the world. You name it, and they can relay the operation live to wherever you like. So it is just unimaginable, the quality of technology that has gone into that. So we know about 3D technology. We know about 3D CT reconstruction. These are two separate technologies. But the real fun is the next technology, which is called as augmented reality image overlay guided surgery, which means that when you are operating in the chest or in the abdomen, the 3D dimensions of the CT scan are actually taken and overlaid on the organ that you're seeing. So the pathology can be seen in three-dimensional even before you reach it. So if you're dissecting the pulmonary artery by an image overlay guided surgery, you can actually see what is behind it. So sometimes when you're dissecting the bronchus and you can't get behind it, there is a risk that you might actually damage the pulmonary artery. But this technology with the 3D CT reconstruction allows you to look behind the structure to understand what is the problem on behind that particular structure, and thus it makes surgery more safer. And not only the platform is available on the headwear, but it's also available on iPads, and these iPads can be intraoperatively put into a protective shield, and you can then easily. Sorry, 1 minute. I have to switch off these guys. Whoever is making noise. So this actually. So this makes your surgery safer, and at any point, the real success of a surgery is vision. And if you can see beyond a structure, and if you can take away all of the blind spots, then the chances of complications reduce dramatically. And that is why this technology is quite important. And not only that, this technology also has the ability to navigate you. So you can actually be guided into what is the next step. So this is somebody putting in a paravertebral catheter, or is it an epidural catheter? And actually the technology, they're looking on the screen, they're not looking at the back of the patient. And the technology is picking up the position of the catheter, and the 3D CT is already superimposed in here. So as that needle is moving in, it is telling them exactly where is the paravertebral space or where is the epidural space. So intraoperative navigation softwares are the next big thing, which I think all of us will use to make our surgeries more clear. And I think they will play a big role in surgical fields as well, because doing a segmentectomy, or more importantly, doing a subsegmentectomy, you really need to know the 3D pathology of the venous drainage and the arterial supply. And this sort of technology will give you a live three-dimensional reconstruction on a patient when you're doing a segmentectomy or a subsegmentectomy. Philips has been working with this project. This is called as image projection or holograms. So again, the CT scan can be actually projected. You don't need a viewing box. You don't need a computer in front of you. Everything is sensor based. And all you have to do is move your fingers apart and the heart will come up. Or if you want to see the angiogram, you move your fingers and you can turn your fingers around to actually rotate the whole image three-dimensionally. So it will give you, you can see in front, back, top, bottom, name it, and you can use it to see. So this is a hologram where there is no actual screen, but the image is being reproduced in front of your eyes, and the movement is correlated with your hands. So as you move your hands, you can see you can see any part of the organ that you're dealing with. We are all fortunate to work with this sort of technology called as the hybrid OR, and I've given you a talk on endobronchial navigation. The hybrid OR comes into its own when you're talking about endobronchial navigation, because it has an intraoperative, what is called as a DynaCT. So this device that you see here is a DynaCT. You have intraoperative screenings, you have name it, it's all in there. And you can do localization of small lesions in the lungs. You can use endobronchial navigation technology, highlight the tumor, inject a dye, inject a fiducial marker, and then turn the patient over and go in by VATS and do a VATS resection. And this is called as image guided VATS, so IVATS. And these are all thanks to the hybrid OR that we have access to. Of course, the Japanese have come up with the RFID chip concept. So they take this RFID chip, which is loaded onto a bronchoscope. This is not that chip. This is just to represent a chip. So this is a catheter technology where an RFID chip is loaded onto a catheter, and you put in a bronchoscope and you inject the RFID chip wherever you think is the tumor. And then when you go in by VATS, on the side, you can actually beep and you can find out where exactly is the tumor. And you can use multiple RFID chips to find out multiple GGOs. So this is all the help that you get in theater to make your surgery safe. And this is all the help that you get in theater to better visualize and, more importantly, to take away the blind spots. Now, as I told you, and I keep telling you again and again, that the most important part of an operation is recording the operation. And the second most important part is editing that recording. So many times over the years, I have found that you do a very good operation and then you look up and you realize your circulating nurse forgot to switch on the recording device. And so that is lost for posterity. You can never learn anything anymore from that case. So recording is a very big thing that I think most of us should pay attention to. A lot of us have this access to IDA recording devices, but now even that is going to go out of the windows, because we are now entering into a world of smart contact lenses. These smart contact lenses have a chip inside it, and they have the circuitry within it. You wear it on your eye, and as you wear it, the vision that you are seeing is getting transmitted to this contact lens. If you want to start recording, you blink your eye and the recording starts. If you want to stop recording, you blink your eye and the recording stops. So you no longer have to depend on anybody else to do your recording. And the beauty of this contact lens device is that it has the ability to link to a Wi-Fi HDD. So these HDDs have now become Wi-Fi or Bluetooth enabled, and your smart contact lens actually talks to this device, and so you don't need you don't need too much hard disk on that contact lens. You can beam the image to this HDD, and this HDD has potential of going from 1 terabyte to 4 terabytes. In fact, now we have got 8 terabytes available. So once your HDD is full up, you just pull it out like taking a cassette out of a tape, and then you put in another HDD and you start recording again. So there is no question of ever losing recording. There is no question of ever not recording an operation. These technologies actually will help you to record dynamically as you are doing the operation. A lot of people want to record open surgeries, and I personally, for open surgeries, I have a GoPro which I can mount on my head mount. The GoPro has a mount which you can click onto the head mount, and it will record. And all of the GoPro activities can be controlled with a iPhone. So my assistant, who's not scrubbed outside, is watching it on his iPhone. And when I tell him record this bit, he just clicks a button and it automatically records all open surgeries. For cardiac surgeons, the same device is available on your surgical loops. So this is the camera here, this is the light source, and these are your loops. The same thing here. They've become smaller and smaller. These are slightly older pictures. The loops have actually now, the cameras on the loops have become lighter and smaller, and they are very comfortable to wear. So any open surgery that you're doing on the cardiac side, including anastomosis, valve surgery and things, everything that you see through the loop is actually recorded by the camera. So there is no question of your head coming in the way or your assistant's hand coming in the way. It is your sight. Whatever you're seeing dynamically will get recorded by that surgical loop. So that's so much so about VATS and things like that. For me, robotic surgery is a completely different world. For me, it's a revolution rather than an evolution. I certainly do not believe that robotics is an evolution of VATS. I think it's a completely different technology, a completely different platform. And this is the one platform where you get in touch with technology on a personal basis. It's very intuitive. It is designed to your needs as a surgeon. So every single surgeon can have his own profile on the robot machine, and every single surgeon can actually do the surgery according to his requirements. Now, because I work across many countries and many hospitals, I have access. I've worked on the S, SI, XI. So you name the platform, and it is available in various hospitals. And so sometimes I have to remember what is the platform and what are the differences between the various platforms. And I'm also fortunate to have access to a dual console robotic program where you have two consoles, so you can teach very well. And I personally am very happy to make the statement that everything that is possible by open thoracotomy is possible by VATS and is possible by robotics. When you sit on a robot, actually you're doing, when you sit on a robot, what you're trying to do is you're trying to dock the robot. You make your 3 ports. These are the 3 ports that you see. And your team is really important. Your team is actually moving the robot into position. When we started the program, docking the robot was a big thing. We actually had to learn how to dock a robot. But now it's not a big deal. What used to take 45 minutes now can be done in minute 30. I think this video, when it was recorded, we did probably in 2 minutes and 42 seconds. So really from the point that you start to the point of the robot docking changes pretty dramatically, and you can actually dock pretty easily the robot. It's all a teamwork and everybody understands what is needed. Once you've docked the robot, you have access to this screen. You sit on the screen. You press in a button which recognizes your setting. The height of the robot changes according to your setting. Then your feet are working. You've got these controls, diathermy right, diathermy left. You have got the camera in your left hand, and you've got the fourth arm control. The robot has a binocular vision, one separate vision for the right eye, one vision for the left eye. So your brain is the one which makes the 3D formation of the vision. So this is a true 3D image. So when a structure lies at 1.3 millimeters on a robotic platform, it genuinely lies at 1.3 millimeters. And then you rest there, put your hand there, put a pincer grip, and then you move your pincer grip right, left, up, down. In VATS, it's a mirror image. In robotics, it's an intuitive image. Everything that you move is intuitive. And so this is the way you get into the chest, and you can do all sorts of complex surgeries. This is a lobectomy, which we are doing. I have a pretty large series of robotic lobectomies for aspergillomas following tuberculosis. And I love the robot in this scenario because of the dense adhesions that you have in the chest wall. The robot actually gives you the ability to dissect into the hilum directly and gives you the ability to isolate the structures, which you actually do not get with open thoracotomy. With open thoracotomy, there is too much dissection and you end up with a lot more blood loss. With the robotics, you actually do a pinpoint dissection and everything is done under vision. So every structure is beautifully identified under 3 dimensions. So in my opinion, the robotic platform makes the surgery safer because the view that the surgeon gets is really second to none. And everything is beautifully magnified. This is 10x magnified when I'm looking into the console. So for me, in technology terms, there is no technology which is superior to the robotic technology. Really, it's just a beautiful, beautiful thing. And particularly when you get into the thoracic outlet and things like that, the ability of the robot to lean over the tissue and dissect is just second to none. And in an aspergilloma, this is very, very helpful because the adhesions at the apex of the lung are the ones that give you the most problem. Robotic platform has gone from 3 ports to now into a single port robotic surgery. This is actually now coming into the domain. At the moment, it's working well for abdominal surgery, but thoracic is not too far away. There are 2 ways to single port it. One is you use your current robot and put it all through a single port with separate holes, which is called as air docking. So your robot is docked outside the body and the instruments go in through a single disposable port, or this new robot, which is the single port robot, also called as spider robot, where you have the camera here and multiple instruments, which will allow you to do the same surgery. The problem with robotics is all this platform is very bulky. You really need a huge whole setup to get this going. So this company has come up with what is called as handheld robots. So these are called as FlexTech surgicals, and these robots are actually held in your hand. So in robotic surgery, you are not next to the patient, you are sitting on a console. With FlexTech surgical robots, you're actually next to the patient, and purely by rotating your arms to the right or to the left, you can get a 360-degree movement of the tip of the robot, and you can get a 7-degree freedom of the endowrist. So these things have made it less bulkier and has certain advantages when you do these surgeries. Immunofluorescence in robotic surgery is a big thing. Use of ICG to highlight the vascularity or to highlight the tumor is something that's being worked upon, works very well in esophageal surgery when you're trying to get a conduit from the stomach all the way to the chest. It's beautiful for identifying the vascularity of the stomach and making a viable conduit. We are using it in segmentectomies in the chest, where it helps you to identify the boundaries of the segment, the vascularity of the segment, and then you can do your segmentectomy via the robotic platform. That can be done. The ICG can be given either intravenously or endobronchially. And 2 of my colleagues are doing a study on this. David Waller and my friend is doing a study on this, Sasha, and they are looking at the viability of endobronchial versus intravenous ICGs for doing segmentectomies. that is not enough for us as surgeons. We want to push the boundaries more. So we are going down the natural orifice route. I gave you an endobronchial surgery lecture where I told you about endobronchial valves. I told you about endobronchial coils. And now we have these steerable endoscopes, which actually have devices coming out at the tip. So you can not just do this for for diagnostic purpose, but you can also do this for therapeutic purpose. The POEM is a technology that is used in the esophagus for submucosal resections using these wireless steerable endoscopes. These work very well also for transanal surgeries or transrectal surgeries when you are trying to deal with carcinoma in situ and trying to do a submucosal resection surgery. We have also gone into the world of endoluminal robots. The endoluminal robots are here. People are working in the labs. I have had the opportunity to work on this, where you can actually go endobronchially, cut open the bronchus, take out the tumor, and on your way out, close it. And so that is the next advancement in the technology that we'll be using. But the oncologists are not sitting quiet. They are working. They have got this intravascular nanobot coming in. The intravascular nanobot is a technology which is based on precision medicine, or it is also called as CRISP, which means individualized therapy for individualized patient. So no longer will you give a blanket chemotherapy regime for a patient. You actually do the analysis of the surface receptors of this patient, you do of the cancer, and then you decide what chemotherapy. So it's like a targeted regimen, and you load the chemotherapy onto a nanobot. So this is the payload on the nanobot. There's a micro camera at the tip, and there is a sensor at the end. The sensor at the end is controlled by the computer outside, and you can drive the nanobot intravascularly. So intravascularly, the nanobot will find its way. You inject it in one area, and then it finds its way across and reaches the cancer cell intravascularly, and it injects the payload into the cancer cell. The big advantage of this is, number one, you reach the area that is the problem, and more importantly, you reduce the amount of systemic chemotherapy that you need to give. Because the most problems with chemotherapy is, of course, the side effects of chemotherapy. So the nanobots actually have an ability to reduce the amount of chemotherapeutic agent that you're going to deliver to the cell. And this will actually make the patient more tolerable to take chemotherapy or to tolerate chemotherapy. Of course, this will also allow you to get into areas which are not accessible by surgery. So sometimes the tumor or the metastasis is in a very difficult area where where it is very dangerous to get in by surgery because of side effects. So the nanobot will get into this area being guided by the surgeon or the oncologist and deliver the payload. So precision medicine is the real word. If a lot of you have not heard this word, I suggest you start reading about it, because this is really the change that you'll have. It's the genomics of lung cancer. We really are going down the route of tailored approach. Each patient needs a particular type of, has a particular type of cancer according to his genetic makeup. The receptors of the surface of the cancer is according to his genetic makeup. So the treatment should not be a combination of A, B, C, D. It should be specific, either A or B or C or D. And so this personalized cancer therapy is what is actually revolutionizing the management of cancer. And so a general population, on the basis of molecular profiling and on the basis of use of prognostic markers, can be divided into treatment A, B, C, D, E, and you then give personalized cancer therapy for these patients. And you do what is called a genome editing. And the genome editing will allow you to actually target the specific cancer cells that you are dealing with. So much so for doing your clinical work. I think smartphones have a huge role in teaching and learning. Today's technology, today's lecture is all based out of a smartphone and out of my Apple MacBook Pro. We are doing multiple live webinars. You've seen it, you have been part of it. I have been working on the Thoracic Gurus platform, and we are relaying education, even though we are in the middle of a shutdown, even though the whole country is not able to get out of the house, we are still able to reach hundreds of people across the world, hundreds of surgeons sitting on their own iPhones, sitting on their own computers are listening to us. And so this is really, really amazing use of technology in very, very difficult times. And not only are we doing that, we are also putting question and answers to you guys. So there is a certain group which I'm actually teaching. I call it a 1-minute education, where I put in a curve or a graph, and I ask them to identify A, B, C, D, and they write back, or you can do this live, and then you can have any type of education that you want, and it can be a personalized education. It doesn't have to be a 3-hour lecture. Just 1 minute of looking at this graph can teach you so many things that you will use in your clinical practice. So this is the way we are going, and beauty of it is everything gets recorded, everything is out there on YouTube videos. The surgical videos are there. Diego has published hundreds of uniportal videos. I have robotic videos. Other surgeons across Asia are all contributing to myatep.com. They are contributing to YouTube, and this education platform is making a huge difference, because suddenly I've realized that people are logging on to these lecture series and in their own time, and they are making notes and they're writing things. So when the lecture is going live, they don't really have to write and get distracted. They listen to the lecture and then they go back and they review the lecture, and particularly when their exam going, they will get back to this platform and they will revise for their exam. So I think technology is playing a huge role in all of this. In addition to this, you've got lots of other availabilities for CMEs. You have Medscape, you have Epocrates, Pepid, up to date. Any of these you can use if you want to identify a sort of current update, if you want to get latest CMEs, or also you can use these platforms when you want to get reaccredited. So like in the UK, all of us have to have done a certain amount of CMEs, 40 hours when we go for our appraisals. And very often, if you've not had a time to attend any meeting in the year, you can go onto these websites and you can actually do the CME late in the evening, and you get a certificate for the number of hours that you've done. So it also helps you with your appraisal and helps you with your general medical council commitment. So these are real technologies that you must use in your day-to-day life. Follow-up is great on these platforms. My system has a SMS clinic reminder. Every patient who's got a date or a clinic booked with me gets an automatic SMS. The database gets filled in through these things. The clinic letters are dispersed via Wi-Fi and the internet and email. All operation notes are electronic. I hardly ever type anything. I hardly ever enter anything in nowadays. All I have to do is just dictate into a dictaphone, and that gets picked up. And the standard formatting is already there. So the important points of the operation get added to it, and the operation note is reproduced. And then, of course, the billing system is all gone on the internet system. So we actually hardly ever worry about billing nowadays. It's all automatic. All I have to do is fill in a code. And the moment I fill in a code, the whole bill is reproduced and it gets docked to the patient. So invoicing, billing, and collection of the billing is all electronic. No longer do you need anybody to actually go and talk to the patient. And even the transaction, the financial transaction is all online on various platforms, either online banking or online transfer or card payments. They are all gone electronic. There is this new technology which has come in, which is called as a smart bandage. So when you finish your surgery and you put this smart bandage on the wound, the bandage reads the condition of the wound. So the patient can have gone home, but you're getting a live relay and feedback of whether the temperature of the wound is okay. Is there any pus accumulating in the wound? Is there calor, dolor, things like that. So this actually gives you a feedback if there is early infection being developed in the wound. My friend in cardiology, I was talking to him yesterday, and he is not worried about the COVID at all. He does cardiophysiology, cardiac physiology, and all his patients, whatever pacemakers he's put, whatever devices he's put, almost all of those devices are Bluetooth enabled. And because they are Bluetooth enabled and they work via a certain secure network, he gets all information on his computer and he can follow up any patient no matter where they are in the world. So this is really made his life easy. I was asking him how is he managing his clinics, and all he had to say was, actually, I'm sitting at home in front of my computer and all my patients' data is electronically beamed to me. So I don't really have to do any face-to-face clinic anymore. On the digital suction device for thoracic surgery, again, the same Bluetooth technology is being installed into the next generation of suction devices. So the patient can go home with a flutter bag and this digital device. And the digital device will talk to you. It will give you feedback on what is happening with the patient. The patient doesn't even need to phone you. And when the flutter stops, the digital suction device will tell you that the flutter has stopped. Please call him back to the hospital and take the drain out. So these interactive technologies are coming in, and the time is still only 6 p.m. You have spent your day, done whatever else you want to do, and then when on the way back on the train, you have all got WhatsApp, and so you phone your family at home in India. You catch up on Netflix. You decide what is the next movie we're going to watch in the evening with your daughter. Catch up on all the other stuff and emails, and that's life. That's life. Really, technology has become a part of our everyday lives. Now, the problems with these things are that there could be a serious information overload. It is very, very important to keep this factor in mind, that you are getting so much information. So you could be mentally tired, you could get eye strain. There is a sense of loss of privacy. I find it very difficult when people WhatsApp me and expect me to reply back within 2 seconds. Or when people email me and next day write to me saying, why haven't you replied to my email? I mean, I could be busy. When you send me a WhatsApp, I could be in the bathroom. You don't know that. So this is a real issue. This loss of privacy and me time is a real issue when you go down the technology route. And of course, the phones ringing when you are sitting with your family or when you're having dinner is very important. So we personally actually switch off the phones. We just completely switch off the phones when we are with me time or when we are with family time. And the expectation of patients have also gone up. They expect you to respond to them, in the middle of the night because he's got constipation for 3 days. I mean, really, could that not wait till tomorrow morning? So this is a problem with technology. The patients feel that they own you. So it is important to understand these shortcomings of using smartphones and technologies. What smartphone I personally would suggest, if you have got access, use, and if you've got the funding, use a high-end iPhone or the Samsung Note series because they have good battery time. For me, the most important criteria for a phone is the battery time. It must last me through the day. Storage is also an issue. So most of my phones have either 128 gigabyte storage, or I carry a small attachable hard, small USB disk which can plug into the phone. And most of the times I try to keep my phones, no personal data on the phones, so that if somebody hacks my phone, he will get nothing. So everything I will transfer to a small USB, which gets transferred to a hard disk drive. The issue is, of course, they are expensive. And the more important problem is when they fall from your hand and the screen breaks. It's a real expensive issue when you have to replace the screen. And the worst scenario would be if you lose your phone, because all your contacts, all your emails are on the phone. So we make sure that they are all locked. Most of my phones, you cannot open them. iPhone 11 has got great security features, and it has got face recognition things. But you don't need to use these expensive phones. I think the cheaper alternatives are available in a country like India. You got OnePlus, you got Huawei, Xiaomi, Redmi. And the beauty of these phones is they are cheap, and you've got lots of power, and use them for 6 months or 1 year and throw them away. buy the latest one next. So you have that option. You can actually now buy a really decent sized smartphone for a decent price. For a couple of £100, you can actually get a very, very good high-end smartphone. But of course, you got to worry about the security and things like that on these phones. Whenever you use smartphones, don't forget the accessories. Most of us buy the expensive smartphone, but we forget about the accessories. Don't forget, online cloud storage is not free. You have to pay for it, and it is a monthly payment. So that has to be taken into account. Always have a very high power bank, because the last thing you want to do is you're in the middle of a consultation and your phone goes dead. That is really unprofessional and really sad. So you must have a power bank to back up. I personally have a Wi-Fi connected hard disk, so I don't even need to plug in the hard disk. I can use any size hard disk with my phones. Screen protectors are a must, and a leather case is a must to make sure that the phone doesn't get damaged. Okay, now I'm going to take a small break here before I start talking about innovations and how you should use innovation. If anybody wants to ask questions, I'm very happy to take questions. I'm going to pause the recording for a few minutes. Sorry, just one second.
Sir, regarding data privacy,
Yeah.
since the data is, but whenever we download any app or something, they ask our permission that we can, unless you accept everything, the app is not functioning properly.
No, actually, all apps, they cannot take a blanket permission. That is what they make you feel, but they are not allowed to take a blanket permission. They have to actually give you. So you must know what permissions you want to do and what permissions you don't want to do.
Yes.
It's your choice. You can pick and choose what permission you want to give to the audience or to the app. Okay. Is it making sense what I'm saying, or is it becoming too much? Hello?
Yes, sir.
Definitely
Yes.
making sense.
sense.
Yeah,
Excellent.
this is all, and it is not expensive. What I'm trying to tell you is, all of this technology is not expensive. A lot of it is available on a regular basis. You don't have to. In the old days, you had to spend hundreds and thousands of pounds, but now it's not like that. It's actually pretty affordable and pretty, within the budgets of most hospitals. Okay, so are you guys, do you want to listen to the next part, or do you want me to do it on another day?
Continue.
Yeah.
Is it making sense what I'm saying?
Yes, sir.
Okay, all right. So let's continue with the next part. I will start sharing my screen again. Screen share. Okay.
So start recording.
Yeah, I have to start recording. Of course, I stopped it. Okay, so some of you asked me about innovations. Some of you asked me about, sir, tell us a little bit about financial planning. So this is not the whole talk. I have a very, very big, long talk on it, but I've picked up selective bits from it. And this is from my experience. Okay, so everything that I'll talk to you is from my personal experience, which will talk to you about how surgeons and doctors must protect themselves, because we are living in really uncertain times, and we really need to think different. Okay, don't follow the crowd. Always be this guy in the middle who's able to look around and is able to have a different perspective on life. And that is what I want you to understand. So all of us are doing well in life. Okay, we are all big time surgeons. Some are top notch specialists. People are working in corporate hospitals. Everybody is gradually climbing the step, the corporate ladder. Everybody is gradually getting to the top. Okay, you might be a junior resident. You might next day become a senior resident. You might become a consultant. You might become a senior consultant, and so on. So it's fine. There's nothing wrong with climbing a corporate ladder. But what if you found that the ladder was actually leaning against the wrong building? What do you do? What if you reached the top and you found that really this was not the ladder I wanted to climb on? what do? The problem is most of the people who reach at this stage get really psyched by it, but more importantly, they don't know what the hell to do. And they continue in that same space for the rest of their life, feeling frustrated, feeling really upset, and trying to climb faster and faster. But the reality is, if the ladder is leaning against the wrong building or the wrong wall, it doesn't matter how fast you climb. It's not going to take you to the correct place in life. So it is very, very important to understand this concept that you may be climbing the ladder of success, but is it actually leaning against the correct building? This is the question I want you to ask yourself. This is very, very, very important. As doctors, all of us, me included, till I understood what I'm talking about, all of us put all our eggs in one basket. All of us. We have one job. We bank on our employer to pay us a salary, or we have one private practice clinic, and we hope that patients come there, and an income will come, and I will use this income to support my family and to pay for my children's education and to buy luxury goods for my wife and for my mother and for my father. All of us have one source of income. That's the reality. Whether you agree or disagree, 99% or at least 95% of doctors have all their eggs in one basket. But the most important thing that you have to remember is that your surgical career is dependent only on this fine tip of the needle. I promise you, your surgical career, the 20, 30 years that you've put, the hours and hours that you spend in the ICU trying to learn cardiac surgery, trying to learn thoracic surgery, is all dependent on a single needle stick, the tip of a single needle stick. The day you get a needle stick injury, the next day or whatever, few months, few weeks down the road, you are at a risk of getting hepatitis B, hepatitis C, HIV. This is the reality. And nobody wants to be operated by a surgeon who is hepatitis B, hepatitis C, or HIV positive. So your career is completely shut down. I promise you this. This is the reality of life. So what are you being arrogant about? And actually, have you made any arrangements to make sure that when this happens, or as we know now, if Corona happens, have you made any arrangements to make sure that your life will carry on? Do you have any alternatives in life? Do you have any system in place so that your children's future is not jeopardized? Do you have any system in place that your children will continue going to this top-end private school or college that you're sending them to? And the reality is no, most doctors don't have it. I mean, yesterday I was sent the CT, I showed it to some of you, and look at the CT. We are operating on a patient like this. We're getting into the chest and trying to drain this abscess on a corona patient. And what is the risk to your own health? I mean, this is what we have to understand. So really, are you willing to bet the future of your children on a tip of a needle? Is that what you want to do? That's the question I want to ask you. I think you've got to think different. You've got to understand that life is very uncertain. There are a lot of realities which may hit you along the way. And until and unless you've got systems in place, you will not be able to handle adversities when they hit you. And it is all in the thought process. It's how you think. If you are not thinking correct, you will continue to climb that corporate ladder and you will continue to want to go up the next rung high and the next rung high and the next rung high. And then 30 years down the road, you realize, actually, this is not what I wanted. So the only thing stopping you in life is your own thought process. And if you're thinking already, why not think big? Why not think different? And that is what I'm trying to inculcate into the group that I talk to. What is the concept of wealth? A lot of us think that wealth is about a huge bank balance. It's about money in the bank and things like that. But it is not. The definition of wealth is never in terms of money. If you really want to understand the definition of wealth, it's not in terms of bank balance. What wealth means is the ability to maintain or increase your current lifestyle if you stop working today. That is the definition of wealth, which means if you've got a certain amount of money in the bank, say 100,000, and your monthly expense is 5,000 per month, then 100,000 divided by 5,000, whatever is the figure that comes up, which could be 6 months, which could be 2 months, which could be 1 month, that is called as wealth. So wealth should not be measured in income or in bank balance. Wealth should be measured in time. And your job as a father, your job as a husband, and your job as a hardworking person is to make sure that the amount of wealth that sits on the side, it matches the expected lifespan. So that tomorrow, if something happens to you or something happens to your surgical career, you will still be able to maintain your lifestyle. That is the key thing. That is most important. And the moment this figure crosses beyond your expected lifetime, then you stop working, you retire. But does not mean you stop operating. It only means that you don't work for money. You work for time and for giving back to the community or giving back to the patient. So always remember, wealth is measured in time, never in finance, never in rupees. So it really is all about wealth. And when you are financially free, when you use the word financially free, all it means is that you have the ability to use your time in whatever way you choose to use it. So it all comes back to time. It is the ability to own your own time. That is the definition of wealth. And that is what I'm going to talk about today. So again, I put this slide up for you because lot of people look good. A lot of people smell good. They drive these very expensive cars. They live in very high-end houses. But all of it is bought on credit. So actually, if you ask how wealthy are you, they are negative wealthy. They have more credit than they have debit in life. So the question you have to ask is, how wealthy are you in terms of time? Tomorrow you stop working. If you get HIV or if you get hepatitis C, will you actually be able to survive for the next 10 years, 15 years, 20 years, maintaining the same lifestyle? And if all your eggs are in one basket, I'm sorry to say, you are playing a very risky game when it comes to financial management. It's very, 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 very important to understand this. So the real philosophy of financial freedom, or real philosophy for doctors to understand about wealth, is to generate small income from multiple sources. The key here is multiple sources. So if something happens to one source, the other sources will kick in and take over, and you will not sink in the sea of debt. So it is very important that each one of you, because you are youngsters, it's even more important that each one of you start generating small income from multiple sources. And it could be $1 from one source, but if you have 1,000,000 sources, it's equal to $1 million. Do you understand that? So this is a very powerful concept. And more importantly, it should be completely automated. Everything that you're going to do for earning your income, everything that you're going to do for creating wealth should be automated. What does that mean? that means that that source will continue to generate the income whether you are present or not present. That is the key. It should not need your presence for that dollar to come in. And so it's very, very important that whatever you do has to be automated. Income should come in whether you are present or not present. That is the bottom line. And so you have lots of options as doctors. Okay, so you have a salary coming in, which is good enough. You can have private practice, which is another source of income. You can have medical legal work, which is another source of income. But more important, I think more important is the royalty income. As individuals, we should all try to get into the concept of royalty income. You know, singers, artists, writers, they all have access to royalty incomes. We as doctors never ever think of patenting whatever we are doing. We just do something new and give it away. And don't even think that if you actually patent the IPR of that device, you don't even have to be present. Wherever the device is used around the world, the income, it could be 0.1% of the cost of that device, but it will come into your bank account, whether you like it or not. The other important side is your websites. A lot of people run websites, but they don't understand the power of advertisement on a website. Your website, your work is like a showcase. And a lot of other companies want to associate with you, and they want to use your brand value to display their products. You're not endorsing their products. You are just displaying their products. And the moment those products get displayed, it's a bit like Google. Every time you hit a Google page, if there is an ad on the side and you click on the ad, that income automatically comes to you because you have directed traffic. And all of this is actually automated. You don't even have to do that. Within the computerized world, that's why I talk of technology. The technology nowadays is so powerful that if you spend a little bit of time and try to understand how to set up the technology, automatically any traffic that is coming to your work, to your website, will automatically get diverted to whoever else wants to come in. And a lot of people on YouTube, a lot of people on Google are making a lot of income from this. And youngsters understand this more than doctors do. And that is why I talk to you. I'm trying to highlight some of the sources. Of course, the standard sources are investments. We've got real estate. Don't underestimate the value of real estate. We're not talking about the appreciation of real estate. We're talking about the ongoing income that can come from renting out a real estate or making into a house of multiple occupancy. Debentures from companies, shares, eBay. Don't forget eBay. There is a lot of power in eBay and Amazon. And I want you to go out there and research how can eBay and Amazon help you develop income. It is really amazing how much knowledge that is there out there, which unfortunately doctors do not know. We think that we are altruistic. We should not have any desire for money in our lives. But the reality is, in households between husband and wife, most fights do not happen because of money. Between husband and wife, most fights happen because of lack of money. Honestly, most fights between couples will happen because there is not enough income coming in. But it is not about income. It is after you get your income, what you do with that income is the key thing that will decide whether you are going to be successfully financially or not. It's not. You really don't need to look at increasing income. You have to work out a strategy to increase income. But more important is how you manage the income that is coming in. That is the key factor that will decide what is going to happen. So that's why I say it's not about earning more. It's what you do with your money after it comes into your hand. That is what decides the secret to financial success. Each one of you, if you look back at your own spending or your own issues over the last few years, you will realize that bank balance is zero because you have not used the money the way it was designed to be used. And I'm not asking you to be stingy. I'm not asking you to reduce your lifestyle. You can continue to lead the same lifestyle, but prioritize some things. And I'll show it to you in a minute. So it's not about earning more. So a healthy relationship with money is mandatory. Earning money is not a crime. You have worked 15, 20 years of your life. You need to earn money because that is the value that gets attached to your brand or to you as a person. When you earn a good amount of money, you feel good about yourself. And so it is very important to have a healthy relationship with money. Don't say that I don't need money. You may say that, but your wife will not agree to that. So it's very, very, very important. So what you do with the money is more important. There are lots of stories of people who win lottery tickets, become rich, but they don't know how to handle the money and they move on to becoming poor again. Lots of stories. Haryana is full of, Gurgaon is full of these stories where the locals sold their land at exorbitant prices, farmlands, got a lot of money, didn't know what to do with it, spend it on A, B, C, D, big vehicles, this, that. And today they are back to the same status that they were there before. And they don't even have the land to farm or the land to till. In fact, one of my drivers he was my driver, and he used to tell me that the building in which I used to live in Gurgaon was actually owned by his father. And they sold the land to the builder. The builder gave them a lot of money. They didn't know what the hell to do with the money. And today he was working as my driver, somebody who actually owned the land on which I used to stay. So this is very important. The concept is called as pay yourself first. Always, always, always remember to pay yourself first. It's mandatory. So when you get your income in, 2.5% must go for charity. You can make it 10%, I don't mind. It depends on whatever is your earning capacity, whatever is your desire to give, but at least 2.5% of your income must go. Before anything else, that should be put aside. 10% of your savings or 10% of your income should go for either savings or investments. Not savings. Money in a bank is no good. Do not keep a large saving bank account. Money in a bank is no good. That money should be put to use. You have to invest that money into whatever you are comfortable with. It doesn't matter. And then you take care of your daily necessities that is required out of your income. Make sure you make a profit and loss statement with your salary slip. It's very important to have a profit and loss statement. And then you pay the government. The important thing is you have to make sure that you pay yourself first, not the government first. Unfortunately, if you're working for a hospital and you are on a pay as you earn, the government takes the money before it even reaches you. And so that's why I strongly encourage you to have more than one source of income. One source can be salary, and there you can do pay as you like. But on all other things, you have to make sure that you pay yourself first. So everything gets declared as a profit or a loss statement, and then you decide what is the income tax on the remaining amount that you make, and that is what you pay. I'm not saying don't pay income tax. You must pay income tax honestly, but the income tax should be on the amount that is left over as a profit from your day-to-day activities. There is a concept called as one penny double. Most people do not understand this concept. When I ask people, if I give you a chance to take a penny, which I will double every day, and on the other hand, I give you 1 million pounds, what will you take? And 99% of people actually say, I will take the 1 million pounds. 99% people say, I'll take the 1 million pounds. I will not take one penny double for a month. Just one penny double for a month. And this is the chart when you see what happens to one penny double over a month. You start off with 1 penny and it exponentially increases. So 2 becomes 4, 8, 16, 32. And then day 29, it is 2.6 million. And day 30 is 5.36 million. This concept, this thought process is called as exponential growth. It is a very powerful concept. If you understand what do you mean by exponential growth as opposed to linear growth, then you have made it in life. Most of you who are climbing the corporate ladder, rung by rung, rung by rung, are actually on a linear growth pattern. This is a linear growth. So you are climbing. Every year you are looking for increment. Every year you're looking for your boss to give you a little bit of extra. Good, you're happy. What was 3 lakhs is 3.5 lakhs today. I am very happy. But this is linear growth. Watch this. This is linear growth. And at one point, somewhere down the road, the linear growth and the exponential growth will cross. And then when it crosses, this is what happens to exponential growth. There is something called as a threshold. And the moment you cross the threshold, you start shooting up double, triple, quadruple times. So linear growth and climbing the corporate ladder will not take you anywhere. If you are actually going to bank on your family's success and your children's future on a concept of linear growth, I'm afraid, my friend, it is not good news for you. You really need to bank it on a curve of exponential growth. That is the reality of life. All incomes should be put onto an exponential growth pattern. Most of us say, I don't have extra money. They say, how the hell can I invest? I am struggling. My salary is finishing even before it starts. I don't have even $5 a day to invest or 100 rupees a day. Most people will say, I don't have 100 rupees a day to invest because my salary is finished. So let me look at what are the other things. If you drink a coffee outside, Starbucks is 350. And again, you can translate it into your own life or into your own country. I don't mind that. But look at that. Starbucks is 350. A lot of people drink a coffee every day. I promise you that. Some people smoke, and cigarettes could easily be anywhere. I don't even know the number, what it costs to buy a packet of cigarette. And I don't even know how much it costs, how many cigarettes people smoke a day. But these are some numbers which I'm putting up. Look at lunch outside. A lot of people will actually spend 500, 600, 700. I'm not saying don't have lunch outside, but to have lunch outside every day is costing you a hell of a lot of money. And really, what do you get? You get oily, greasy lunch. How about making a sandwich yourself at home and taking it with you? Because lunch is not what you want to have a very light lunch to get on with the day. So I'm just pointing this out to show you what are the outgoings that people have in their lives. Cable TV, something with 1,000, 1,100 channels. 1,100 channels, do you really watch 1,100 channels every day? But you pay 30 pounds a month, $30 a month for 1,100 channels. And out of that, you would probably watch 5 or 6 channels. So you have to think about these smaller numbers and think how you can take income, you can take money out of these smaller outgoings and create a portfolio where it gets into investment. Netflix, a lot of people get Netflix, but really, a lot of movies on Netflix may not be what you want to watch. Internet, we have the highest package. We have 100 gigabyte a day or 100 gigabyte a month. I mean, honestly, do you use 100 gigabyte? If you look at your internet usage, all phones record internet usage. I promise you this. And somebody like me who does a lot of work on the phone, I probably use max 5 gigabyte a month. Max. I promise you this. Because there is Wi-Fi everywhere. In the house, in fact, over the last month, because I've been in the house close to a Wi-Fi, I have used 0 gigabyte of my internet usage. So on your mobile phone, look at it, see it, and think whether is it really, do you really need it? Most of us have the highest phone package with lots of gigabytes, but really, the other big thing is direct debit programs. We've got these things where automatically 100 rupees get cut out of your bank, and you might even have stopped the service and you forgot to stop the direct debit. So there are at least 15, 20 direct debits in every household. I'm not talking about everybody. Some people are very cautious about it. They make sure that the direct debit is cancelled. But a lot of us, we change houses, we forget to change the direct debit. And the companies bank on this. That's why they give you a discount for going into direct debit. EMIs. A lot of us have EMIs, but not many of us actually research alternatives to EMIs. Where can I reduce my EMI per month? There are a lot of other options. Credit cards are the worst enemies of mankind. They are the worst enemy of mankind. I I travel, every month I must be doing at least 20, 30 flights easily across at least 5, 6 countries. I do not carry a credit card. I do not have a credit card. I don't need a credit card. I live in all 5-star hotels across the world. I don't use a credit card. I do use cash or I use a debit card. I've got my own debit card, but I have no credit card. I have no debt and I have no loans because that's the only way. I mean, when I was young, I've done all these mistakes. So whatever I'm putting out here is credit card is the worst mistake you could make because before you know it, you think you will pay on time. Every single time you think you will pay on time. So you have 56 days to pay it. But the day you forget, the day you get to 57 or the month that you get to 57 days, they are charging you interest for all of the 56 days. All of the 56 days, you actually end up paying interest. And then when you calculate, miss 2 or 3 payments in a year, you have paid them interest for 150 days in the year. Can you imagine that? And this is the way they make sure that they get every single dollar. So why not stop that? Why not pay our credit cards on time? And that extra money which you are going to be giving to the credit card company, why not use it as an investment tool to get your exponential growth going? That's the point I'm trying to make. And look at this, $5 a day of exponential growth. $250 is around $5 a day if you give or take few. If you work it, most investment tools that you work with across the world over 20 years or 25 years work around 10 to 11% income. Some may have 14, some may have 4. But an average income of a investment tool when it is invested across 20 to 25 years is around 10 to 11%. And actually $5 a day in 20 years is going to give you 3.3 million. Imagine this 3.3 million is actually now logged into a category of exponential growth. So slowly your $5 is increasing, is becoming whatever the number is, but a penny double a day. On day 29, the 3.3 million from 29 to day 30 will actually become 6 million. So it is very, 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 very important to understand this concept. And accumulation should start early. If you're young, this is the time for you to start accumulating. It may seem foolish. Everything I'm saying may seem as if this is your father talking to you. But actually, these are the mistakes which I have made. And I am talking to you from my own experience that I wish somebody had sat down with me 20 years ago and told me, please put away $5 a day. And if you just put away $5 a day, at 10, 11, 12% return on that, whatever is your, I'm not asking you to take interest. I'm talking you to invest in tools, whatever tools you want to use. Eventually, that amount is a very, very significant amount, enough for you to retire on. Okay, that's very important to understand. Again, within the investment portfolio, don't put everything in one basket. Diversify. Make sure that you understand the market. Make sure you put in gold, in bonds, in stocks. You must have it all over the place, whatever you do. So a real important person is to have a good stockbroker or understand the technology online. Nowadays, you don't need a stockbroker. Online, everything can be done online. There's something called as futures trade. There is something called as foreign exchange trade. Some of them are risky things. Some of them are safer things. Go with whatever is your personality. If your personality is more towards the risky strategy, work that strategy. But knowledge is important. But more important than knowledge is applied knowledge. Having knowledge is no good. Listening to this lecture is no good until and unless you go back tomorrow and apply it to your own life. It is really, really important to live life debt free, because there is nothing like peace of mind and a good night's sleep being debt free. I am not a huge proponent of debt. Some people say you must use other people's money and other people's time to create wealth. I personally think that you must use your own money and try to create. I'm not a financial expert. Trust me, I'm not a financial expert. But my experience over the years has shown me that being debt free is the best state you can be in life. That is really, really, really important. Now, I'll give you a real life example of how you can create an income stream. Okay. So this is from my life. When I came to India, I wanted to start training surgeons, anesthetists, pulmonologists. I was really pushing hard to train everybody to do video assisted thoracoscopic surgery. But and the idea was that people in tier 2, tier 3 towns started doing VATS. My aim was to encourage innovation within the people. Okay. But the problem was the people came to my courses. They did all the courses, they learned the VATS. But when they went back, they found that the instruments were very expensive. They found that the staplers were very expensive, and there was really no training available to them when they were setting out on this pathway. So my philosophy at that time was that if you give a man a fish, you feed him for a day. If you teach him to fish, you feed him a lifetime. But more importantly, you have to give them the fishing net. That is the most important thing. Teaching him to fish is great, but if he doesn't have a fishing net, there is no hope in hell that he will start fishing. So that is where we started working on. This is just one example of how we created an income stream. So in India, jugaad is the big word. People try all these different ways to do things. And we said, why don't we try an Indian jugaad to make VATS possible? Let's see how we can do it. So I sat down and I worked on this software called as AutoCAD. I learned about this software, and then I saw that actually AutoCAD is a fantastic technology to help you to design an instrument. Now, this is not my video. I'm using some professional guy's video to show you how he is changing every little bit of an instrument, changing the design, and he's recreating an instrument on table. So this is what I'm showing you on AutoCAD, how using very simple tools. It's not difficult to understand this tool. You can very easily create anything that you want, anything. You name it and you can create it. So here he is, he's created this. Now he's going to duplicate it and put two on top of each other and make a scissor out of it. So this is one way how people create instruments. Okay. So look at this. This is the tool. Here he's putting a clip on. Now what you do is you take the design from AutoCAD, it gets saved in a certain file, and then you send it online to the producers. There are people who will do 3D printing for you. Very easy. AutoCAD talks directly to the 3D printing software. And the moment you've put in whatever design you've put in, the 3D printer can actually create a model for you, a demo for you. So look how he's creating a demo. I think this was a bird cage which he's creating. So it's a beautiful, beautiful technology for having a prototype. Whenever you want to do something or create something, always when you have a prototype, life becomes very easy. The company people understand it much better than just designs. So a 3D prototype is what we need. A lot of cardiac surgeons are using this to design new cardiac valves. The 3D printing is being used to design chest wall templates. So whatever you want, you can do it. And there are a whole range of things that you can come out with 3D printers. And that is the technology and it is available for really no cost. You don't have to buy the 3D printers. You just use the AutoCAD, create whatever you want to do, and send the design. Anything that's in your mind, an idea, is useless until and unless it is on the table. So to make that idea appear on the table, you create a plan, you create a 3D model, and then go to some local guy. I went to this guy in one small little place. He runs this company which doesn't even have a name. He's handwritten this board. And then he works on these machines, and he creates a lathe. And the important thing is, out of that came a whole set of instruments, which was a prototype for me to go to a bigger manufacturer. The moment I managed to make a set of VADs, then it was time for me to go to a bigger manufacturer. And the bigger manufacturer, you don't have to make a print of this. You just tell him what is your requirement. This is exactly what I want. This change I want here, this change. And you can have a whole set of instruments ready for really no cost. It's very cheap, very cheap. I mean, if you go to buy a Scanlan set, every single instrument costs about 1,500 euros per piece. And this set, this is designed and tailored to my needs. I use this set. This can be made for less than $500, the whole set. 10 to 12 instruments, enough for you to start doing that. So whenever people came to my wet lab, I would tell them that, you have to take this set and go back and start doing it. And you start using it. Once you start using it, then you get used to the instrument. That is when you decide that you want to buy high-end Scanlan instruments or whatever. Till then, please just use these instruments and get on with it. And I know people who 3 years down the line, 4 years down the line, are still using these instruments. They have not bought the expensive instruments because they are happy with the work that they're giving. And then what happens is, once you have a prototype, once you've got things going, then the international companies get involved. They get interested in your prototype. You talk to them, you tell them. I've had 2 actually instruments now accepted for production. And these companies, when they produce these instruments, it comes with your name attached to it. So there is the dignity of having your name attached to an instrument. So the ones that are made, I think one of them is called as Professor Khan's decortication faucet. Every time this gets sold anywhere in the world, Australia, New Zealand, wherever, I'm not doing the marketing, but a small percentage of that income lands up in my bank account directly. So, and it's important to copyright your work. Either you get Indian copyright or international copyright, but you must speak to a patent lawyer and you must patent your design. It's absolutely important. Indian patent lasts for 14 years and international patent is really the way to go, because otherwise the Chinese companies will quickly copy your design. So it's very important to get your patent and get the thing going. But for you to move out of a salary pay as you go, you need to have your own company. You need to register your own company. In India, it's very easy to do it as long as you have the official documents identifying you. You need 2 proofs of address. Once you have those address, you register your company in your name. The moment you register your company in your name, what happens is you get legal rights and you get tax benefits. So now, every time, now when you take a flight from Bombay to London, if you, who is working in a salary, and you pay 50,000 rupees for that ticket, you have already paid 30% tax on it. And the 50,000 that you've got, you are paying a further 20% sales tax on it. So really, 50% of your income is going to the government even before it reaches you. And then you are paying 50,000 and traveling to London. Look at the other scenario. If I travel from London to Bombay, when I buy a ticket, it is expense. For me, for my company, it's bought on my company's name. That is expense because I'm traveling for work. I have not paid tax on it as yet. So 50,000 I spend, that gets deducted from my earnings for that month, and whatever is left over is taxed by the government. Do you understand that? So I am paying tax last. You are paying tax first. And you are, in addition to that, paying tax on already taxed income, which means you're paying a VAT or whatever it's called in India, I don't know. So you are paying double tax on the same income. Whereas I am paying VAT, I'm paying income tax, I'm paying income tax, but I'm only paying it on the profit I make, not on the total amount. Do you understand that? So anytime I drive a car and I fill up petrol, that is tax deductible. Every time I eat in a restaurant for a business lunch, that is tax deductible. My office in the house as a separate office is tax deductible. It's a rent that I pay to the owner. The owner could be me, but it is officially and legally allowed to be tax deductible. My internet is tax deductible. I pay it out of my pre-tax dollar. My whenever I buy a computer, that is for official work, that is tax deductible. It is expense. So what you need to have is expenses, and that is how you have to work this thing. And it's legal. Everything is perfectly legal. The whole system is designed for company owners. It is completely against pay as you go earners. So register a company. Always have a business account. Never ever run on a personal saving account. Or everything has to go through a business account, because business account has a very high daily withdrawal limit, and you can deal with international currency on it. In India, you have a problem with exchanging currency. UK, we don't have that problem. But in India, if you have a business account, you can actually pay in dollars, you can pay in pounds, you name it. And it is legally allowed within the guidelines of the company, within the guidelines of the government. Don't forget to have an import-export license. Doesn't take much to get an import-export license. You have to make an application, a small fee. The moment you get import-export license, you're able to get it within 2 weeks. Then you start dealing in foreign countries. Everything you buy overseas becomes a legal part of your company. Don't forget to finance your projects. If you have any ideas and you need some money, don't dip into your own pocket. Look for research grants. Okay, look for venture capital. Speak to people who are willing to invest in you. You must have a brand value. You must be the guy who will bring value. So then these guys will come to you and they will want to invest in your company. And don't forget to look for government programs. There are a lot of government programs which want to encourage young entrepreneurs. They want to encourage young doctors doing things. So these are alternate sources for income for your project. But important to remember is you won't get it right in the first go. I promise you, you won't get it right. You will make mistakes. But the key thing is to make mistakes. It is important to make mistakes. You must fail. You must fail. But every time you fail, you must fail forward. You fail often, but you fail forward. And every time you fail forward, you get up and start taking another step. You learn something more about how the financial management works. Nothing is impossible. That's the mindset. Nothing is impossible. Tools are just meant to facilitate you. And if none is available in the market, you make your own tool. And when I talk about tools, I'm not talking about instruments. I'm talking about whatever else. Debentures, shares, etc., etc. Whatever takes your fancy, you make your own tool working for you, because that is how mankind has progressed. When I started doing all this, when 10, 15 years ago, when I decided to come from England to India to work and set up a VATS program, there were two roads in front of me. One road was a road of comfort, working in the NHS, having a very good salary, comfortable life, 9 to 5 job, and home on Saturday, Sunday. That was a beautiful state of life. But the other one was going to another country, restarting your practice in India, setting up a robotic program with all its challenges, tuberculosis stopping you at every stage. That's not possible in tuberculosis. Everybody telling you it's not possible. So there were many, many challenges. But I took the one less traveled. I did not take comfort. Comfort zone is the worst thing that you could do to yourself. If you stay within the comfort zone, you're going to make zero progress. Then 20 years down the road, do not complain when your colleagues are doing really well and are well settled and are retired, while you are every day still going to work 9 to 5, 9 to 5. I always say 9 to 5, work for somebody, but 5 to 9 in the evening, work for yourself. Do these things which I'm telling you to do. So the key to all this is to take the road less traveled. And that, my friend, has made all the difference in the world. It is the single most factor. It's a thought process. You have to change your thought process. You have to think differently. And the moment you start thinking differently, you start acting differently. The key to everything is action, not knowledge. You can listen to my lecture 200 times, but if you don't do anything about it, it is completely useless. completely useless. The key to everything is knowledge. Yes, there is fear. There will always be fear of doing something new. I promise you, fear of failure is the biggest thing that holds people down. But the the only way to get over a fear of failure, or the only way to get over the fear, is to start doing something. The moment you do it is the time when you realize that the fear has suddenly disappeared and life starts to make sense. So you can choose to evolve, as I said, or you can choose to be extinct. It's not a problem. It is your life, your choice, your children's future on the line, your parents' expectations on the line. Makes no difference to me. But I do hope that you choose to change, because it is the strongest of the species that survives, not the most intelligent and not the most jazzy one. It's always the one who is most responsive to change. That is the one that survives, not the strongest, not the most intelligent. And Charles Darwin was very right when he said these things. Thank you. Okay. I'm going to stop sharing my slides. And if you guys are still there, you can talk to me. Or if you are tired and you think I'm talking
We are here, sir.
No, I have a question. I have
if
lots
you
of
think
things
I'm
to say.
talking bullshit, that's okay, because this is my life and that's your life.
I have lots of things to say.
Okay. Tell me.
Uh,
Tell me. You wanted to
yeah.
talk.
So, okay, by far, this is the best lecture of yours. Like, it's like above the tracheal resections and the cranial, whatever.
But Shilpa, let me tell you something. Let me tell you something. You know, it's only people who want to make a difference, they stay on. This is the lecture which has the least attendance. Did you notice that?
But they don't know what they've missed.
Because people do not realize what is the value that is there in other things in life. Everybody is thinking hemoptysis, cough, expectoration, things like that.
This is why I'm still
But
here.
this is the lecture which is
no.
going to change life. And I deliberately did not say anything about, I put out a message saying this is not for the exam. And what happens is the people who are on this group, every day I'm having a house, but people are flocking. They can't get in. But today I have the least attendance. But I have no regrets. I am actually very happy, because this is designed for people who want to know what is the inside story.
Secondly, so I've just started, like, I've begun to talk. So second point, according to me, this was a lecture delivered jointly by a businessman, a CA, and a tax practitioner. So it was like these three people have delivered this lecture, not a, it's not a surgical person. Now coming to the question was about your software, that 3D design, AutoCAD. Yeah. So, hello, can you see me?
Yeah, I'm listening. I can hear you.
Oh, yeah, you can listen to me. So okay, fine. So about the software AutoCAD, doesn't it need a parent instrument picture to build a 3D image, 3D printing image? Like, for example, I'll give you, building a scissor and all is like no big deal. But if you want to make an Indian NAS bar, how are you going to make it?
Yeah, AutoCAD, you need straight lines and curves. That's all.
How will you make an Indian NAS bar? NAS bar, it's not available in India.
What is NAS bar? What is NAS bar? NAS bar is a flat straight line, two straight lines with curves at the end. That's all you need.
But it differs from patient to patient, depending upon the Heller's index, Spector's index. So how are you going to... I tried this.
There is a technology called as integration of 3D CT. So you do a 3D CT recreation. There is a guy in Medanta, in the plastic surgery department, who has got this 3D software, and all you have to do is give him the 3D CT. And the moment you give him the 3D CT, it goes into the software, and the software then talks to AutoCAD, and it gives you the exact measurement of what is needed for the patient. This is physics. It's so simple for the IT guys. It's not difficult. This is physics. There are enough. You have to research it. Of course, it doesn't come overnight. What I spoke to you today is 20 years of research. You know, I come from a very simple background. I don't come from a business background. My father used to work in the railways, earning one income of about 2,000 rupees a month, an honest, straight man, and 4 children studying in English schools. And all of my brothers, 2 of them are in the US. One is a director of a company in India. He was a wing commander in the Air Force. I am double PhDs. My mother had studied only up to 7th standard. She can't read or write English. So all of this is come from experience and a desire to be. See, my strength as an individual is that I am very sensitive to change. I very quickly adapt to change. I don't get scared of change. And 2, I'm very hardworking. Formulas. I'm telling you, just being sensitive to change and willing to work hard is the formula. You don't need great wealth to do all of this that I told you. You really don't need great wealth. You just need to be able to apply the knowledge. You know, we are living in the world of knowledge. Information technology is everywhere. Google can give you 220,000 pages when you type in a search. But how to filter that, and more importantly, how to apply that. Most people get up to the point of knowledge, but they don't apply it because they're scared. Fear is a very important factor in all of this. And you think I don't get scared? This today, before giving this lecture, I was having butterflies in my tummy. I said a prayer before I started the lecture. I swear by God,
you're quite bold. I have to say this, you're quite bold.
No,
You're just let out tips and tricks of the trade entirely. Who does this?
In the gut of my tummy, I was feeling butterflies today.
Yeah.
Okay, and I give 300 lectures a year. But every single time but you have to overcome the fear. And the only way you overcome the fear is by putting the Zoom to live. I go live 30 minutes before. 1 is to let you log in, and number 2, to give me time to settle in. Because that is the way you overcome fear. Fear is overcome only by action. Most people actually decide to do a lot of things, but the fear becomes so strong that they do not take the action. And the problem is the only answer to fear is action. The moment you start doing it, it all follows. It's all semantics after that. Okay. Anybody else wants to talk? I'm sorry. Hi, Harish. Good to see you. It must be very late there, isn't it?
It's 2 o'clock in the morning and I can't sleep.
Oh my God. Have I made you lose
everyone
sleep over
sleepless?
this?
Exactly my point.
Dr. Khan, I would like to give you a few views. The first thing is that I commend you for doing something spectacular during this period of time. I've seen on our WhatsApp group, every day you've got a new lecture and you've got the whole group together. You know, you're just constantly giving lectures and you're constantly updating us about new things. And it's amazing what you're doing. I don't think any platform in the world is actually doing this right now. So
thank you.
Really, like I said, 3 claps and 3 kudos to you. It's a hip hooray, kudos to you for thoracic surgery. It's amazing. My first question when you started talking about technology was that, you know, you talk about, we travel. One of the big things with this COVID thing is that we're all restricted at home right now.
Yeah.
And the main thing before this was in conferences, we would travel and fly to wherever, to India, to Europe, to Singapore, to Asia, whatever, to listen to people talk. And do you think this is, with this whole new coronavirus and this Zoom landscape, it's going to change the way we do conferences?
Absolutely. Life is not going to be the same at all. But the people who are going to be winners are the people who anticipated the change.
And do you feel that the future conferences, like big conferences like, you know, the ESTS or stuff, everything's going to be now live streamed on Zoom, and we maybe pay a small fee to get in?
Absolutely.
And we can listen to it literally on like our doorstep?
I think that is the way the future is going to be. It's going to change. No longer will you feel comfortable shaking somebody's hand.
Yeah, absolutely, absolutely. The second thing I wanted to comment to you when you gave that talk about building your future, I think that was an amazing talk, especially to everybody here, because that's what we, when we're younger, and you're a young man too, we're just younger than you, um, give his experience about investment and talk. And so when you talked about, it's called compound interest. And it's very important that I only learned this in the past 2 years, is that we put our money into other people who invest for us. And a lot of times that these people that we put in, say you put in $2,000, $3,000, they actually, when you join these mutual funds, they actually they tell you, oh, we're only charging 1%. So if you actually, your first investment is $100, 1% of $100 is literally $1. But when your wealth accumulates to $200,000, that's actually $2,000 a year. And you
Absolutely.
multiply that, so it's compounded interest. So they actually start taking away a lot more money than what you actually do. So it's brilliant what you did. Now, the question I wanted to
Just a
ask
second.
you.
I want to comment on this, Harish. Since you
Yeah,
brought up this issue, let me tell you one thing. It is the key thing that you must understand about building wealth is that you must pay good people good price to advise you.
yes.
So, if you pay peanuts, then you get monkeys working for you. Most of
But
the
a lot
top
of
people
people charge
will
you a
pay
lot
a
of
top
money for
dollar
giving you
to
peanuts.
the best experts because of the value they bring to the table. So it is
I
something,
know.
it's a balance of the two. But you're right, you got to understand the concept of compound interest.
You got to understand the concept of compound interest, and on top of that, that once you start understanding, you learn a little bit, and we're all surgeons, and so we think, oh, let the finances be done by other people. The
Right,
reality is that these
absolutely.
other people are actually just salesmen. So once you learn it, I actually learned it in this past 2 years. I've taken control of my own finances, and I learned to build
Absolutely.
it myself. And I'm saving a lot more money doing that than paying these
Absolutely.
salesmen to do it. Um, the other point I wanted to bring up to you was that, talking about finances, is that as junior doctors, when we're starting our career, we work for a university, or we work for a certain senior, or what have you. And as we build, now sometimes a lot of universities look at us and say, oh, if you were to go private, you're going to the dark side. Now, how do we change this perception to the younger people that say, this is your life choice, and that going out and trying to make a living for yourself is actually not a bad thing?
Absolutely. Education is the only way. That's why you need to catch them young. You need to talk to them when they are youngsters. I mean, if you are already a professor, you are, I have this thing about, nature meant you to turn into a beautiful butterfly. But if you don't push the boundaries, you turn from a caterpillar into a senior caterpillar. So,
Right. That's a nice
senior
way to say.
caterpillars are no good. And there are
Yeah,
hundreds of senior caterpillars around you.
yeah.
That's the reality.
So there are a
So
lot
we
of
have to
people
teach them when they are
who
young. That's why these lectures are important.
there are a lot of people, and this is what is so commanding of what you're doing right now, because you are, and this talk about finances, I was like, wow, I didn't even see this coming. And I want to, because we're all in a crossroads sometimes. We're senior slash junior slash senior category, where we look and say, like, should I go out and build my own practice and do my own thing? And a lot of people say, no, we don't want you to do that because it's the dark side and you're going for money. But the reality is that you're actually just trying to build something for yourself. And we need to send that message out that it's not a bad thing what you're doing. And people who tell you it's a bad thing, they have their own self intentions for doing that.
Yeah, absolutely. See, reality is, Harish, whatever you're doing is for the future of your children. The
Yeah,
why has to be emotional always. Whatever you
yeah,
do, you have to identify why you want to do, and it's got to be emotional. If it is for my child's future, I don't care what my colleague thinks or my professor thinks, because that emotion is so strong. that no matter what anybody thinks, I don't care. I'm doing it for my children. Full stop. That works for me.
And thank you, sir. That's a really reassuring statement that you just actually made. Yes.
Good, fantastic. Good to hear from you, Haris.
Well, I'm gonna silence
Anybody else?
myself off.
No, go ahead. It's all right. Anybody else wants to say something, or I'm happy to call it a day? Everybody is gobsmacked.
Excellent.
They don't know what to say.
I'm very.
Stunned.
Sir, I'm
People
very,
are stunned.
No more words to speak.
Oh, one more thing. Do you actually wake up at 4:30 in the morning?
Yeah. Most days.
Mind
When,
waking up, for sure.
most days when I do, because you see, I travel internationally, so I'm always in a jet lag state. If
Okay.
you know what I mean. So I never know which place. So actually, most days I wake up 4:30 in the morning.
No, I'm
And
just trying to
before
create an app
7,
to
and
erase
also
my
because
snooze.
no, before the
Wow.
children wake up, you finish a lot of your work. You see, that's the other
Yeah.
thing. Once the children wake up, then I go and drop them to school, and I do all these
Right.
stupid things. I love it. I love to go and drop them to school. I love to pick them up from school. I do all these random things which give me great pleasure. And being alone in the car with my son, we have a real man-to-man talk. That 15 minutes, but we have a real. So it's fun. I enjoy those things. So now I
you're a
do
good
less
man.
work, but more quality.
I think, besides the educational talk, today's talk was extremely brilliant and it was timely. Well done, sir. Thank you very much for.
Thank you, Harish. Thanks a lot.
All right.
Good to have you on the group.
All right. All right. Have a good night, everybody. I'm gonna.
Okay, good night. You go to
Good
sleep,
morning,
Harish,
yeah?
2:00, huh?
Yes, sir. Good night, sir.
All right, good night. See ya. Bye-bye. All right, guys. If anybody's got anything else to say, say it. Otherwise, I'll call it a day. I'll just close this session. Tomorrow, Adrian, who is going to give his talk from Malaysia. So the one that we missed yesterday, he did a Zoom meeting with me today, and we got the
Yeah.
problem solved.
He was
And
there in
he's-
talk today.
Yeah, I know. I told him to log in today to just listen in and see what is how his connection is late in the night, because we weren't sure whether it has got to do with the time or what. So he logged in, he checked in, and it is all working fine, I think. Okay. All right.
Yes.
Good night.
You're going. I mean, I still had a question.
Yeah, Shilpa, you can ask me any questions you like.
Per oral, yeah. Do you want to say something about per oral staplers? I've heard about it.
I spoke about them actually. I spoke about per oral
Still you
staplers
don't
when I
mention
did
it.
some. I spoke about it, and I have not yet done the esophagectomy class. So when I do esophagectomy class, I'll talk about per oral staplers.
Hmm.
If you got some idea, go ahead and
I
make
have an idea. I'm telling you, I'm just finding a. That's why I keep on writing
Don't
a
tell
mail.
me
Because
about
I'm
it.
not.
Don't tell me about it. You do your idea.
I have
and
got
make
an
yourself a
idea,
check.
desperate idea.
Don't tell me. I will
I'm not
steal
able
your
to find
idea.
a good person. No, that's why.
Steal your idea. So be careful.
It's very risky thing.
It is very
No, I want to make a device patent. Only thing it has to be.
So do it. Trust
I'm
me. The
not
one thing
finding the trajectory. No,
I will never steal anybody's idea. That's my philosophy in life.
That's why I keep on writing your mails.
I
but you do
always
not reply.
No, my problem is I cannot give one-to-one coaching. That's my problem. So, I just I cannot take on that responsibility. That's my problem. That I cannot
I
give
desperately have an idea, and
one-to-one.
I'm really very, very picky to share it with anyone, even in this place, because I'm
Well,
not.
then
I'm not sure.
you have to hang a carrot in front of me.
But it's about a
All right.
device.
Okay.
Yeah.
Okay. All right. Okay, guys. Thank you very much. I hope you enjoyed it. I hope it was
Thank you very
something
much.
different. And good night to everybody.
Right, sir. Good night, sir.
Thank you, sir.